Morning, everyone. Hope you're all feeling rested from dinner yesterday. For all who are in attendance, and for everyone who's attending the summit, welcome. My name is Babusi, and today I'll be sharing with you a story of transformation, one in which a startup was able to harness the power of mobile devices to increase access to healthcare. This is a story about a boy named Kofi, who represents the hopes and dreams of millions of Africans who seek better access to healthcare. Our journey began with a seemingly insurmountable paradox. In a continent where less than half of the population have access to healthcare, mobile connectivity was soaring. And what this represented to us was an opportunity to harness the power of a generation that is growing up in the age of the internet and leverage those behaviors in order to build a bridge between doctors and patients in a continent where doctor-patient ratios average 1:5,000 at minimum. We recognize that this digital revolution could be harnessed and create a powerful tool for change. And with mobile phones in hand, the people of Africa were more connected than ever before, and we wanted to capitalize on that. So we created SisJoyce, Sila Health's chatbot that provides health-based information for young Africans. And this didn't start as some crazy machine learning GPT variant. It actually started as a very simple spreadsheet. We created a spreadsheet with a basic decision tree that allowed us to get insights on how young people in Africa wanted to experience a chat interface that would give them access to healthcare. And this was moderately successful. Moderately because we had a massive uptake in the use of the platform, but we ran into one tiny problem. People were just a little too polite. Actually, people were just too familiar. We had built the chatbot to answer specific questions, but then the users preferred to start their conversations with, "Good morning, SisJoyce. How's been your day, SisJoyce?" And as a startup that had created this with the hope of just validating the idea, we were of course not prepared for all the small talk that the people who use the platform really wanted to get into. So we went back to the drawing board. And what that looked like for us was trying to understand the unique cultural context of our users and understanding that that was very crucial for our success. We knew that in order to create a valuable tool, we needed to really dive into the behaviors and the cultural, nuances that our users were presenting to us in the form of the version of our chatbot that was just fed from an Excel spreadsheet. And what this looked like for us was diving into the unique context of our users across the continent in order to piece together a mosaic of their hopes and fears and dreams in order to understand exactly how to resonate with them on a very personal level. And ultimately, what we were able to achieve was to not only build a chatbot, but to build a personal health assistant. Today, users of SisJoyce have exchanged over 1 million messages globally in over 13 African languages across 50 countries. We've also built modules on top of our ability to understand these users, modules that allow African governments, for example, during the outbreak of the COVID pandemic, to understand the spread of the virus before they even had access to testing kits. We also allow expecting mothers to understand their pregnancy journeys from conception until childbirth at every step of the way in a way that feels natural to them, that is contextualized to their experiences, and is also articulated to them at whatever level of literacy they have. But apart from this quantitative growth, the true win for us has been the quantitative. We really appreciated the testimonials that spoke to the power of small talk and its ability to create lasting and positive change. And every person we've helped is a testament to the power of a human-centric approach to creating and embedding interventions such as these in communities that are desperately in need of them. And looking ahead, our vision is pretty clear. We aim to reach every corner of Africa, ensuring that access to reliable health information and effective health management is not only a luxury, but is a basic right. And Kofi, our mission is to ensure that he and millions like him grow up in an Africa where health information is free. Thank you so much.